Hey you guys, it's your girl Fat Fairy here. Welcome back to another channel. Today's video is going to be a chit chat about my nursing journey. I have gotten a lot of followers on TikTok because I've been posting my what I do in a day as a ICU nurse practitioner. I've gotten a lot of questions. I've gotten a lot of positive comments saying that they don't see a lot of people my color that are in the ICU working as nurse practitioners. So I figured that I'd do a detailed YouTube channel on my nursing journey, how I started, how I got to where I am right now. Also, if you have any questions that I didn't answer in this video, go ahead and leave a comment under this video. If you're new here, my name is Fab Farah. I am a lifestyle, beauty, fashion, and content influencer. And go ahead and like, comment, and subscribe on this video. And thank you for watching. So let's get straight into this video. So just a little bit about me. My name is Farah. I currently reside in Florida. I have been a nurse since 2013. So it's been about, since 2013, so it's been about 11 years since I've been in the nursing field, in this nursing journey. I feel like I have done enough to have a little say in nursing and so forth. So just a little bit about my nursing career and how I started. So let's back up. I graduated high school back in 2005 and I went to go get a pharmacy technician license. I started working in the hospital as a pharmacy technician. I was a pharmacy technician for 5 years, okay? Now, I never wanted to be a nurse, okay? I never wanted to be a nurse. I never had that in the back of my mind. But it's not until I started working in the hospital setting and seeing how nurses work that I had an interest in nursing. Like I said, I had worked in the pharmacy as a technician, delivering medications and stuff like that for 5 years, and I decided to pursue nursing. I went to do my undergrad in nursing, so I did all the prerequisites, the biology, the chemistries, the calculus, and all those classes that you need. And then I applied for one program only, which I got accepted to. I applied to one program as an undergrad, and that program was a BSN, meaning Bachelor of Science in Nursing program. I already had my associates from college, and I went into university. The program was 2.5 years, or maybe 2 years, I don't quite remember, but I did graduate with my bachelor's in nursing, all while working full-time as a pharmacy technician. Mind you, nursing school is very rigorous. It's very time consuming. It takes a lot of your time. It takes a lot of your energy. It takes a lot of your ability and focus. So I was working 40 hours in the pharmacy as a pharmacy technician, working 3 to 11. So I would literally wake up early in the morning, go to nursing school, and then go to work from 3 to 11 in the hospital. And I did that for 2 years, almost 2.5 years. Also during that time, I was studying for my boards in the state of Florida. It's called the NCLEX, which is the board test to get your license in nursing. So I was studying for the NCLEX. If you don't know, in the state of Florida, the max amount of questions, and I don't think they've changed it, but back when I was testing, the max amount of questions you could get in the nursing test is 265 questions, okay? I took the entire test because what happens is if you're doing really good or if you're doing really bad when it comes to the testing, your test will cut off at 75 questions depending on your momentum. So let's say that you started the test and you're doing poorly, like you're just doing really, really bad. And you don't know if you're doing bad until you actually fail the exam. So if you're doing really, really bad, your test will cut off at 75. If you're doing really, really well, your test will cut off at 75. So I didn't have that, which was a blessing in disguise because I literally sat down for the whole 6 hours and took 265 questions of that exam, okay? So mind you, there's people that their tests were cutting off at 75. So I was like, oh my God, they must have passed. But you don't know until you actually see the results. So Thankfully, I did pass, although I did take the entire 265 questions. So, but when it did cut off, I went into my car and I cried and I called my mother. I was like, Mom, I'm a failure. I don't think I passed this test. This test was so hard. Oh my God, I'm such a failure, blah, blah, blah. But thankfully, with God on my side, I was able to pass the NCLEX exam with 265 questions, and I'm not afraid to say that. So I, got my license. I was licensed in the state of Florida, and there comes the job hunting. Now, what people don't tell you about nursing is that looking for a brand new nursing job, meaning if this is your first nursing job ever, it's a little bit difficult because, one, you have no experience. Two, you're not looking in the right places. As a brand new bachelor's prepared nurse, you want to try to work in a hospital setting, because let me tell you why. And a lot of people will say negative things about working in a hospital setting. I feel like working in a hospital setting as a brand new nurse gives you great foundation. It gives you great foundation of basic nursing skills that you need to work in any other field in the world, because nursing nowadays has so many other fields, so many other things you can do with your nursing license. But I think if you lack the basic nursing skills, you won't know when there's emergency or when there isn't. Okay, and I say this because I've worked with many nurses. I've been a nurse myself, so I know when people lack the basic foundation of nursing, because it shows through your work and it shows through how you care for your patients. So my recommendation for you is, if you are a brand new nurse and you are looking for a job, I highly recommend, and you may not like this advice, but I highly recommend that you start working, or you start your first job in a hospital setting or an acute care setting. Because believe it or not, even if you do 1 year, if you do 2 years, once you leave that setting, you're going to be able to take care of a patient. You're going to know when there's something wrong with their patient. You're going to know when their blood pressure is too high. You're going to know when their blood sugar is too low. You're going to know all these things, okay? So that's my recommendation, is to get a hospital / acute care setting job. Second is resume preparation. You want to optimize your resume. You want to make your resume nursing based. And there's a lot of templates on Google, on Canva, that have good resume templates. If you want a resume template, I have a very good one that I am going to link below for you if you're interested in purchasing a resume template. Super basic, super straight to the point, and it actually gives the employers what they're looking for. Second is to, even if you pass your nursing boards, never stop learning, never stop growing, never stop looking at the newest guidelines, looking at the new evidence-based journals, because when it comes to nursing, when it comes to the medical field, you will always be a student, no matter what degree you have, no matter how much experience you have. Being in the medical field in general, you don't know everything. You will never know anything, because there's always some new study, some new medicine, some new evidence-based guidelines that's just going to help you stay in the know. It's going to help you stay current with today's healthcare. So back to my nursing story. As I got hired as a bedside nurse, and I got hired into the med-surg telemetry floor. Now, if you don't know anything about med-surg and telemetry, you get a lot of patients, okay? Now, back in my day when I was bedside, I was getting 6 to 7 patients med-surg telemetry. And my OCD and the way that I like to care for my patients could never allow me to work in a med-surg telemetry floor with 7 patients, because I am too thorough. I don't want to miss anything. My consciousness could never, okay? So I lasted in a med-surg telemetry floor for 6 months, okay? And at that time, the hospital that I was working with, they had a program for new nurses where you had a support group for nurses that were new to the nursing field, and basically you can go in and talk to someone about your struggles as a new nurse. And when I tell you, my first week on a med-surg telemetry floor, I was like, nursing's not for me. I can't do this. Okay. And my mentor at the time, who I love so dearly, she was like, Farrah, you can't give up. You can't give up. Like, you're meant to be. I was like, no, I made the wrong choices. I knew I should apply for pharmacy school. Like, this is not for me. And she was like, you know what? Maybe med-surg and telemetry is not for you. Let's try the step-down floor, or the PCU floor, or the step-down ICU floor. And I was like, you know what? She was like, it's less patients, but they're more critical, but it's less patients, and allows you to be a little more thorough. I was like, you know what? I'm going to give this thing one more try. Okay. So I got moved to another floor, because if I didn't get moved, I was going to quit. I was going to quit nursing in general. Okay. I got moved to a step down ICU floor, which was a respiratory unit. And most respiratory units in the step down ICU floor, you're dealing with chronic patients. So patients that are trach, and if you don't know what I mean, trach, they have like little holes in their neck that allows them to breathe. You have these big ventilator machines that go off every minute. You have drips, you have monitors, you have alarms, and you have very sick patients. So my first day walking into that step down ICU floor, I was like, nope, I'm turning my badge in. This is not for me. They paired me with a lovely preceptor who was so laid back, who was so calm, who was very smart, but also very safe. And he taught me the beauty of remaining calm in emergent situations. And when I tell you, I took it and I ran with it. Years later, as a nurse practitioner, you can ask anyone that I work with, any of my colleagues, they will tell you Farrah is the most calm person you can ever work with. And I say this because of him, my preceptor. I say this because of him, because we always had a crashing patient. We always had an unstable patient. We always had a patient who didn't do well. And he was the most calm person. And I always used to say, why are you so calm? He was like, listen, Farrah, it's either you remain calm and the patient survives, or you have an anxiety attack and the patient doesn't survive. Your patient surviving is based on how you react during an emergent situation. It allows you to think clearly. It allows you to remain calm in situation, and it allows you to focus on the patient and not on your emotions. And when I tell you that stuck with me, it stuck with me. So it helped me navigate as a new nurse in the step-down ICU floor. It helped me navigate when I encountered a critical patient. I knew what to do. I knew that I needed to remain calm. I knew who to call. I called the right people. I made sure that my patient was stable. I thought about all the important things for my patient, and it has helped me tremendously, tremendously, okay? And I will never forget him for that. So I was able to grow as a nurse in the step-down ICU floor, and I remembered that I won Nurse of the Year on my unit, and that was pretty cool. I also got picked to travel to a nursing conference and speak on progressing as a brand new nurse. It's a lot. I wish I had like memories of it, but I don't have any. I have pictures of it. But anyways, I did win Nurse of the Year on my floor. I also was picked and chosen to speak at a nursing conference with my job. And then I did 6 years. Let me back up. So then so when I was working in the step down ICU, I actually got called and asked if I wanted to cross train into the ICU. Cross train meaning being trained in both specialties, ICU and step down ICU, because I was only trained in step down ICU. So my manager asked me one day and say, hey Farrah, I think you'll be a good fit for cross training. I think you would do well in the ICU, because at that time there was a shortage of ICU nurses, so they were cross training a lot of the step down ICU nurses to work in the ICU. So I was like, man, I don't know, like I'm barely making it on step down ICU. She was like, Farrah, I think you'll be great. Go ahead, let's just see how you like it. So I ended up doing the training for the ICU, and it was a rigorous training. I think it was a 4-month boot camp where you did like telemetry courses, you did ACLS, you went over like the dynamics of an ICU patient and how to care for an ICU patient, and then you started the floor clinicals, okay? So when I started doing clinicals in the ICU floor, I had a good background, especially with the vents and the trachs, because that's all I had in the ICU floor. But I started working in the ICU. At this time, patients were intubated, you know, they're on sedation, they're on all these type of different analgesics, all this type of anesthetic medications. So those medications are something that I had to get acquainted with, because I was not familiar with sedation medications. I was not acquainted with anesthetics or analgesias. And I was also not used to patients being sedated. So I'm used to my patients talking to me and communicating with me. So it was a different dynamic. Patients were definitely critical. You had to be on your P's and Q's, because honey, you can't miss a beat in the ICU, because honey, anything gets missed. Okay, so I started training in the ICU, which I ended up falling in love with. I fell in love with the ICU. I fell in love with the people there, and I decided to go to ICU full time. So I was sad, but I was also excited for the new journey. I ended up leaving the leaving the step down ICU permanently, and started working as a full-time ICU nurse. And that's where I was able to get more training, more exposure to the critically ill patient. And I did another 4 years there. So total, I did step down ICU for 3 years, and then I did 4 years in the ICU. So I did a total of 7 years at the bedside. During my 4 years in the ICU, I was also thinking about, man, I feel like I've accomplished it all. You know, I feel like, you know, man, what's next? What is next? So I loved the ICU, don't get me wrong, I loved it. But I felt like I wanted something more. I was like, man, should I go to another specialty? Because OR didn't really interest me. Pre-op PACU didn't really interest me. So I was at a crossroad between CRNA school and and nurse practitioner school. And I chose nurse practitioner school. One, in the state of Florida, if you choose to go the CRNA route, you cannot work full time. The programs in the state of Florida are very rigorous. They're very time consuming. They take a lot of your time. So it is recommended that you do not work, or that you do not have a full-time job. I didn't have that leisure of not working, because I don't have a sugar daddy. So I opted for going the nurse practitioner route, which I'm so happy I did, because I'm very happy with my role. Here I am 4 years later as a critical care ICU nurse practitioner, who specializes in CVICU, meaning cardiovascular ICU. I work with a lot of cardiac surgical patients, a lot of pulmonary patients, a lot of ECMOs, advanced heart failure. I also do a lot of medical and neuro ICU. I also do a lot of neuro ICU. I work with a lot of neuro patients and whatnot. And yeah, that is my nursing story. If you are interested in nursing, if you are at the crossroads of choosing what career, and it could be any career, I have one advice, and one advice only. If you're going to choose nursing, don't do it for the money. Don't do it for the money, because even though I get paid fairly well, the money is not enough. The money is not enough. And nursing is such a changing career. Ever since COVID, nursing has changed. Nursing has changed tremendously. And people don't do it with heart anymore. People do it with money. Do it for the money. And it shows. I see when patients care, I see when nurses care, and I see when nurses don't care. And if you're going to choose a career in nursing, know that it's gonna take up your time. You're gonna miss some holidays. You're gonna miss some family time. Your life will be, you will become part of the hospital life, whether you want to or not. And I'm not saying that you're gonna be stuck. Don't get me wrong. You're not gonna be stuck, but until you find a way out for yourself, nursing will be part of your life, and you have to be okay with that. Nursing is hard. It's not easy. And it sometimes have you questioning your life. So that's my advice. If you're gonna choose nursing, do it with heart, not for money. And if you are a nurse out there, a nurse practitioner, a CRNA, if you're out there, you know exactly what I mean. Do it because you have the heart. You have the heart of caring. You have the heart of caring for others, not for the money. So guys, thank you guys so much for watching. Thank you guys so much for listening. My nursing story and how I started and how I got here. Hopefully you guys now understand how I started in nursing. And if you have any questions about nursing, if you have any anything that you want to know about nursing, if you're new here, if you're a nursing student, if you're a nurse practitioner student, if you're a CRNA student, anything that you would want to know. And thank you guys so much for watching my video. Thank you guys for allowing me to share my nursing journey, nursing story with you guys all. I appreciate you guys. And again, if you made it to the end of this video, I appreciate you. And guys, if you're a nursing student, if you're an aspiring nurse, if you're a nurse practitioner student, if you're a CRNA student, anything in the nursing field, if you have any questions, please comment below. I want to hear your questions. I want to comment. I want to engage with you. And yeah, thanks for watching. I love you all. Bye.